Have you ever felt like shoulder recovery was a maze with no exit signs? One day you wake up feeling you've turned the corner, the next you're wondering if you'll ever get back to your life you had after surgery. It's like a roller coaster, one that leaves you second guessing every moment, every twinge, every bit of progress. Maybe you've asked yourself, am I doing too much or not enough? If that sounds familiar, then you're not alone. And here's the truth. You're not failing you, the system is. And that's why I made this video, because if you've got shoulder surgery on your calendar or you're already deep in the recovery, what you need isn't more vague instructions. You need clear step-by-step map. Stick with me for the next few minutes and I'll walk you through how the shoulder recovery method can guide you through this, through the toughest parts of the progress, so you can stop guessing and start healing with confidence. And even if you decide this program isn't for you, it's okay. This video will still give you tools, insights, and clarity to make your recovery smoother and less stressful. I want this to be helpful no matter where you are in your journey, because no one should have to recover in the dark. Hey there, I'm Dr. Dan Orcutt, orthopedic surgeon. I've helped over 1,000 people recover from shoulder surgery and shoulder injury, and I created this channel for one reason: to give you the clarity, the truth, and the reassurance you're not getting anywhere else. Today, we're breaking down a recovery approach I wish every patient had, one that takes you from anxiousness, confusion, to confidence and control. Before we get going, I'd love to hear from you. What is the most frustrating point in your recovery right now? Drop it in the comments below. I'll read every one, and it helps me understand what's going on and make videos that is going to help you. Okay, so let's dive in. Let's talk about pain and understanding your pain. Pain after surgery isn't just normal. It's your body's way of sending information. But without the right context, that information can feel overwhelming, feel like a siren, making you stop short of movements that actually could help you heal. For example, Maria, a patient of mine, came in convinced she'd torn something again because her shoulder ached when she reached across her body. After we looked at her, examined her, evaluated her, in reviewing the rehab routine, we found that this pain was just her soft tissues adjusting, nothing dangerous. Think of it like this. The check engine light in your car sometimes comes on. Sometimes it's serious. Sometimes it's just saying to tighten the gas cap. My job, and what I'll teach you in this program, is how to tell the difference. So let's go to 2. We now need to establish a timeline. Recovery isn't a straight climb. It's more like a hike in the mountains. Switchbacks, ups and downs. Sometimes you go forward, sometimes you go sideways, sometimes you even go back a little bit before you push ahead. In the recovery method, I help you map the progress in realistic phases. Phase 0 to 1, pre-op to 2 weeks, prepare, protect, and control pain and swelling. I named this section, prepare and survive the suck. And then there's phase 2. Phase 2 is from 2 weeks to 4 weeks recovery. This is general mobility work that happens. I named this the time of great confusion. And then phase 3, 3 weeks to 6 weeks. This is termed by me coming out of the fog. One of my patients, Rich, got frustrated at 5 weeks because he couldn't lift his coffee cup without hurting. Once we mapped out his timeline, looked visually where he'd been and where he was going, he saw he was right where he needed to be, and his anxiety disappeared almost instantly. It's like following the GPS. You don't panic when there's a curve in the road. You trust this is still leading to your destination. So next, let's talk about building a support system. You can't and you shouldn't truly do this all alone. Whether it's a spouse, a friend, a hired caregiver, having people around you, physically and emotionally helping you, is just as important as the physical therapy. One woman I know, Ellen, she lived alone, felt overwhelmed in the first few weeks, especially with things like managing the pain, sleeping on the sling, and wondering if she was doing anything wrong. Was she making mistakes? But then she joined a small Facebook group. This group of other people recovering, and everything seemed to start to shift for her. She wasn't alone anymore. People were checking on her. They were sharing the post, her post, their post. They commented on her post, what worked for them, and just letting her vent when she needed it. By week 2, her anxiety had dropped dramatically, and her confidence started to build. She wasn't just guessing anymore. She was supported. understood, and finally had a sense of direction. Think of a sports system like a spotter at the gym. They're not actually lifting the weight for you, but they are making sure you can push yourself carefully and safely. Let's go to the next step. Let's talk about gentle movement and why it's essential. The instinct after surgery is to freeze, to avoid anything that might mess up the repair. But the truth is, guided, gentle movement tells your body it's safe to start moving, start restoring that range of motion. Imagine if you parked a car in the same spot for 6 months. When you finally got back to it, the brakes are stiff, the tires are flat, and it groans when you turn, right? Your shoulder works the same way. Without movement, the tissue stiffens, the circulation slows, and that's why even in the early stages, you need to move. So in this program, I'll walk you through safe, your surgeon-approved movements once we confirm exactly what you're clear to do in your recovery. So these aren't workouts, they're gentle movements that help reduce stiffness, improve circulation, and send the message to your body, it's safe to heal now. So the next step, we would say, is staying positive. It is super important, so let's break this down. It's easy to let frustration take over, but the research is clear. Your mindset plays a direct role in your ability to recover. One of my patients, Rich, kept a small journal of wins. Every day he wrote down what he could do and looked at this each day. The shoulder did better that day, and over time, this built momentum and kept pushing him forward, even when progress slowed. Think of positivity like a tailwind when you're cycling. It doesn't remove the hills, but it does make them easier to climb. That's why I've included simple, evidence-based mindset techniques inside the program. Tools that have been shown to reduce pain, improve sleep, and help you stay motivated during the toughest weeks of your recovery. You don't need to be a meditation expert or write pages in a journal. We'll show you exactly what works and how to apply it, even on the hardest days. So if you're finding these tips helpful, please hit the like button. It lets YouTube know that this is worth showing to someone else. And if you want practical shoulder recovery advice every week, subscribe so you don't miss the next video. Okay, now here is one of my favorite transformation stories. So Jane, I think of Jane a lot. Before I created the shoulder recovery method, I had put together a less structured version of the program, kind of like a program before the program, if you will. So Jane had surgery and was waking up in the middle of the night, worried, again, similar story, worried that something terrible happened. She'd torn something. She would have to start all over. So she avoided even the gentlest movements. She was convinced that might all undo it, right? The progress would be gone. But within 2 weeks of implementing just a portion of this program, everything changed. She finally understood what her pain meant. She had a clear plan for each stage of recovery. And most importantly, she stopped feeling so alone. By the end of the program, she was back to driving, cooking, and even gardening without second guessing every step. That is the shift I want for you. Not just physical healing, but peace of mind, confidence, and the sense that, yes, you're finally on the right track. So if you want structured guidance like this for your own recovery or your loved one's recovery, click the link in the description below to learn more about the shoulder recovery method. And don't forget to grab your free copy of the Preop shoulder checklist. Just put Preop below and we will send you that resource. Shoulder recovery doesn't have to be confusing, doesn't have to be isolating or filled with second guessing. With the right plan, the right mindset, the right support, you can move forward with clarity and confidence. So if this video gave you hope or direction, give it a thumbs up and subscribe for more. The road to recovery isn't always easy, but it is a lot smoother when you know where you're going. So thank you for watching, and I'll see you in the next video.